Dr. Yurth, such an honor and pleasure to meet you, and I'm really excited to talk to you about something that's going to fascinate my listeners and viewers. We're going to be talking about Spermadine, and you are the expert. But before we dive into that, tell us a little bit about you and what you do and why you do what you do. And thank you so much for joining me today.
Well, first of all, Dr. Lee, thank you so much for having me. My background's interesting because you and I are going to come at this from sort of different places. I actually got my start in medicine in orthopedics. And so you kind of go, well, how does orthopedics relate to the things you do? And we'll kind of get to that because it's all probably going to relate to fixing the cell. But I got my start in orthopedics. I practiced orthopedic for 30 years and still do. Actually do a lot of orthopedic regenerative medicine now. But about 17 years ago, I started to get a little frustrated with the fact that people really never got better. They never healed. So I started to look into how do you actually heal people? How do you actually make people healthy? Probably the same workaround you got to from your training on the brain to, wow, it's not all just about serotonin, right? And so you kind of do these workarounds. And so 17 years ago, I went back and I said, surely there's a way to actually make people healthier and then their joints won't just fall apart. We won't just head everybody down the road to replacing a knee. And so I actually went back 17 years ago, kind of early on in this world of regenerative and health medicine, and got training from the American Academy of Anti-Aging Medicine and longevity or regenerative medicine. And then kind of a few years ago, sort of started to realize that maybe even functional medicine is kind of missing the boat a little bit. And let's look down a little deeper than just at organ systems and let's look at the cell. And I think that's where you and I are going to overlap a lot, is that everything's going to come down to a cellular level, whether it be your messed up knee or your messed up brain. It's going to come down to kind of fixing things at a very cellular level. And that's what I think, and that's where I think this amazing molecule we're going to talk about, Spermidine, is going to come into play, is because if you're fixing things at a cellular level, you're going to help your brain, you're going to help your joints, you're going to help your heart, you're going to help your liver. So that's kind of my, where my practice got its start. And now I'm full-time at a clinic called Boulder Longevity Institute, where we sort of focus on what's called cellular medicine. We help people heal at a really base level.
I love it. That's what fascinates me. And you've done the most incredible work. So I just want to honor the work that you've done all these years. And I love that you've come full circle to look at the holistic patient and to look right down to the level of the cell. And yes, we talk in the same language because everything in our mind is affecting us right down to the cellular level. And we've got so much ability to influence how we function on a cellular level. You don't address it at that basic level, and it can address the connection to the mind. I always talk about how the mind is influencing us right down to the cellular level. It's one of my main statements.
Exactly.
So when I was reading about you and listening to your podcast, some of your interviews, I thought this is someone who's talking my language. I just absolutely love what you do. It's brilliant. It's absolutely brilliant.
So like I said, I think that unless we start focusing on you and I working together, how do I fix the brain, me on how do I fix the body and the joints, unless people start looking at this all as one unified field, we're probably not going to make much headway in this longevity health span realm that you and I are both working towards.
I can't agree with you more. There's such a bioreductionistic model in medicine, as we know, and in psychiatry, it's just a disaster. I mean, it's just
right.
Looking at your brain makes you do everything. Meanwhile, it's what are you doing with your mind that's actually driving the cellular level that's then the output. And you also mentioned about how people don't recognize that if you've got a sore joint or something, your brain is involved and your mind's involved. But I don't know if you're familiar with from years ago, the work of Dr. Sarno.
Yeah, John Sarno, sure.
Okay, so, I mean, he really was quite revolutionary back in, 30, 40 years ago in this.
Right.
We're talking about how if I've got a mosquito in my studio here, talking about back pain, we've got to talk about what are we doing with our mind? What are we doing with our lifestyle decisions, which affects us right down to the cellular level. So I'm so pleased I always love talking to doctors like yourself that have really got into the nuts and bolts of how to bring holistic medicine to practice. Now, you said something very interesting in your introduction. You said even functional medicine, which has been touted as it's fantastic, but you said even that's missing something. And would you mind just quickly emphasizing that? Because I can't agree more.
Because I still think what's happened now, functional medicine doctors have all said, okay, everybody needs hormones, for this or that. And it still comes back down. We actually started a group, it was kind of founded by Dr. William Seeds, who, in looking down a little deeper, okay, yes, your liver is important. And, so we took general medicine, which took a disease focus. Yeah. And then functional medicine said, well, that's the wrong approach. Let's take an organ system focus. Well, that might not be the right approach either. We probably have to go down to the cell and maybe even the mitochondria, right?
Love it.
To actually say what is affecting every one of those things. My ovaries and my heart and my liver and my brain are all affected by the same type of cell. And when the cell becomes dysfunctional at any level, it's going to affect every one of those. So we took it down a notch even further and actually started an organization that's now doing fellowships in what's called cellular medicine. So we took it down from functional medicine to cellular medicine. And I think, hopefully there's not a deeper level than that, there might be, but I think that we're finding a lot of answers to questions that you can now work on a very small little thing and repair a lot of pieces. So, so when we come down to, you're right, that your mind changes your cell changes your mind. You've got to repair the cell. And that's what I think we need to focus on a little bit today and educate everybody out there, all of your listeners, that unless you sort of fix things at a very, very, very narrow level, and for me, this was astounding because I had to go back and relearn biochemistry. Those pathways, remember your Krebs cycle, all those things you learned, you're like, oh, I remembered that long enough to write it down on a test, and then I was done with it. Well, now I had to go back and learn all those pathways plus, 1,000 more that have been discovered since I left medical school many years ago. So once we go back to this pathway level and we see what goes wrong at the pathway level, you can begin to understand what starts off every one of these diseases, be it depression, be it anxiety, be it cancer.
I love that. I think it's vital. And you talk about the mitochondria. One of the things that my listeners hear a lot of, and that's why I'm so happy you're going to dive into the cell, is I tell them how, we've got somewhere between, 37 to 100 trillion cells in our brain and our body. And every time like right now, people are listening, people are building memories of our conversation. And it changes every cell in our body. So it doesn't mean the mind changes, the brain changes, and every single cell of your body is changing in response. So if we don't look down to the cellular level, we're going to miss stuff. And I've been doing some of the clinical trials I do with telomeres and things. And so, we have to recognize that the link. So let me hand over to you. You're an absolute expert, and there's hope for people because you've also worked with Spermadine, which is a phenomenal product that I'm going to let you explain way better than what I could. So you can take this, Dr. Yurth, wherever you do, because however you explain it is brilliant. I love listening to you.
So it's interesting. So I actually don't even work for the company. I just love the product, and I've done some ongoing kind of consulting with them.
I didn't. Thank you for clearing that up. But you know about the product, and we're going to speak about that.
Yeah, and so I actually learned about Spermidine years ago, and it actually hadn't made it to the U.S. yet. It was big in Europe and it hadn't really made it to the US. And I was like trying to get it here because I was really learning about all the amazing things it could do in terms of repairing the cell. And then finally connected, and they brought it to the US and kind of have been a fan ever since. But it's funny because there was a lot of debate when it came to the US whether to change the name. Because Spermidine sort of, for all of us, it's like, sperm, what? I'm going to take something that's, I just saw some Vogue magazine article actually where some actress was using, they said, this actress is using some sperm on her face, which isn't really the case, but it got its name because it was first discovered by von Leeuwenhoek, who discovered the microscope. And so I always tease that if a woman would have discovered the microscope, we never would have found spermidine, because of course the first thing a guy did when he discovered this microscope was he took his new toy and he looked at his semen. And he saw all these little crystallized substance, and he's like, "What's that?" It turned out to be spermidine. So it's rampant in things like semen and breast milk.
Yeah.
So anything that's really a lot in semen and breast milk, those are two things that have to keep cells alive, is probably really important to our overall health. That was the first discovery. So many, many, many years ago, in like 1678, that was when they first saw it, but didn't really recognize its importance really until much later. So it's really it's a little protein. It's a polyamine. It's and it's basically it occurs in our bodies naturally. So it's in a large content in our ribosomes, which are our little structures in our cells that make proteins. So they read out your RNAs, your messenger RNAs, and they make proteins. So it occurs in very high amounts there. It's also found in our diet. So we can eat foods that are rich in spermidine, such as wheat germ, soybeans, peas. Some of the smelly cheeses have a lot of broccoli. A lot of places you can get it from your diet. In fact, one of the thoughts is that one of the reasons the Mediterranean diet is so good for us is because it has very high amounts of spermidine. But the problem is that most of us don't get enough in our diet. And as we age, we don't have as much of it in our bodies. So as we start to see lower and lower levels of spermidine in people's bodies, we see that equates to more poor health. So we know that people have higher levels of spermidine have better health, have better longevity. People who eat more foods containing spermidine have better health and longevity. So it really became kind of, sort of brought to the forefront by some work by Dr. Frank Medeo. And he first really looked at it in 2019 in some studies that really showed how much it would benefit longevity. So really 2019 is when it kind of became really prominent as a molecule that we could look at. If we take this molecule, can we actually delay aging? Can we help health? And since then, numerous, if you Google spermidine in almost any disease, you can find a study, correlating to it, even depression. So we can get into that, but even some study actually ongoing right now with spermidine and depression. So that's supposed to be completed in December.
Sorry to interrupt you. That would make sense because depression is not a disease per se, but depression is a response to life circumstances. Like our mind experiences life, puts it into our brain and our body. We're going to get the impact of life, and we're going to see changes in our cells, and we're going to see changes in the autophagy process and everything that the spermidine does in the way our body responds as a result of, not as the cause. So what I love about what you're talking about is that we don't have to now. I just want people to my listeners to realize we're not saying that there's another cause of depression. This is another impact of depression. So if we realize that, we can then support, as people are healing from whatever caused the depression, there are other things you can do to support that process on a cellular level, which is amazing. I just want to clarify that.
Exactly. So let's talk a little bit more about that, because you kind of threw out that word, that autophagy word, which, I'm not sure how familiar your listeners are with that, but when you look at these stress responses, so as you talk about these stress responses, one of the things we know that happens when the body's under stress is we make more inflammatory molecules, right? So when we're put under stress, that actually raises. So just by putting a mouse or you in a stressful situation, if I measure things like bad inflammatory proteins, like interleukin-6 and interleukin-1 beta, and something called tumor necrosis factor alpha, these are inflammatory proteins. They link to a lot of diseases. So if I put you in a stressful situation, I will see those go up. So your reaction has now increased inflammation in your body. Mm-hmm. And that's where, a lot of the things you teach, well, how do I react differently? How do I, focus differently so I don't get that inflammatory response? Exactly. But in general, that inflammatory response occurs to most of us when we're put in stressful situations, be it emotional or physical, right? So if I put you in a physical stressful state, then I will create these inflammatory markers. One of the ways our bodies respond to that, once we get this high inflammation, is to increase autophagy. Autophagy is the body's response to get rid of damage. So think about autophagy, which means self-eating. Autophagy, self-eating. Mm-hmm. So if my cell gets damaged, so it has a lot of damage to it. So I have this bad event, something happens, my body has a stress response. I produce all of this inflammatory processes. My body has to get rid of some of the damaged cells that created. So in the best case world, those cells that were damaged die off, they kill themselves off, they go away. The good parts are recycled, and my cells stay nice and healthy, and I go on and I get better and I heal. But if I don't have that process, I don't have normal autophagy because of age, or because there's too much stress, or because I have other underlying processes going on, or I just reacting horribly poorly to my stress, and I get what's called dysfunctional autophagy, which happens most of us as we age anyway. So those bad cells now don't kill themselves off. We actually like to call them zombie cells, because those damaged cells now spew out all these proteins that actually damage the cells around us. Now you have this propagating event. In the brain, that occurs in neurons. So if I have these neurons that have been traumatized, create all this inflammation, and I can't get rid of the damage, that damage actually propagates. And it feeds and feeds and feeds until you get depression, anxiety, but keep going from there. Why is there a link to depression, anxiety, and dementias, right?
Yeah, exactly.
It's because that ongoing inflammatory process, if I can't get rid of it, is going to continue to propagate. So if we can improve autophagy, then we can hopefully help deal with this damaged cells, get rid of all this damage, and our bodies go on and heal much more appropriately.
Brilliant.
So think about autophagy as one of the protective mechanisms that we have to deal with damage.
You know, what you're saying makes me so excited, Dr. Yurth, because I talk a lot about mind management, and you've just described that process. If we don't manage our stress, if we don't manage our minds, this process that's supposed to work for us starts to work against us. That's pretty
exactly right. I mean, that's exactly right. There needs to be a reaction to stress, right? We with no reaction. It's like you need to have a little inflammation. You need to have a reaction to a wound to heal, to a virus to heal, to an emotional trauma to heal. If you don't have a reaction to it, that's not good. No. But a reaction that propagates and doesn't end goes on to develop all those things that you and I are familiar with, right? In a joint, it goes on to develop arthritis. In a brain, it goes on to develop depression and dementias and other cognitive decline. Mm-hmm. So what we can do is actually focus a little bit on how do we all improve autophagy? Because in the longevity world, we've linked dysfunctional autophagy to almost every disease.
That's incredible. And this is really established research. I just want to stress for my listeners.
This is all very established research. This is a big piece, is that we have to control autophagy, delay aging. But that's very linked to diseases. Even depression now have been linked. In fact, I know you're not a big fan of antidepressants, neither am I, but and the way antidepressants have been touted to work on neurotransmitters has been pretty much disproven, right? The neurotransmitter theory of depression is not right. But do antidepressants sometimes help? They do. And one of the reasons is because some of the antidepressants actually are very good autophagy-inducing agents. Not quite as good as spermidine, but they actually, one of the ways that's been proposed that maybe they have some benefits is that a couple things like Prozac actually have some autophagy-inducing benefits. So there may be a play that one of the reasons antidepressants have been helpful is because in some people, not everybody, that they have an effect on autophagy. But is there safer and better ways of doing that? Yes.
And I'm so glad you mentioned that safer and better ways, because just for some of those that think, okay, well, therefore I can go and, I'm going to be okay. What the research is showing long term, there's a boomerang effect. So there may be initial good change in terms of, autophagy, but it has a boomerang effect. It kind of gets distorted very quickly. So people need to be aware of that. So you telling us about an alternative that's healthier.
And also in the way it's doing it. So inducing autophagy, right? So there's a fine line between autophagy and then too much autophagy. If I start killing off too many things, that's a bad thing, right?
Exactly.
So the focus always wants to be to do things at a level in a way that our body is used to doing them. So things like fasting. So fasting is the cheapest, easiest way to induce autophagy. We know that short-term fast put our body under stress. When our body's under a little stress, it upregulates autophagy, and we get rid of damage. So there's even been a couple of studies that have linked short-term fasting to helping in some early depression cases. Now, long-term fasting, probably not so much. So some of your people who are doing longer fasts, that might not be a great thing, because that now may actually be too much stress for the process. And the reverse problem, right? So there's a balance there. So whenever I'm practicing my type of medicine, cellular medicine, I'm going to go back down and try and make the cell work the way the cell is supposed to work. Not throwing things in up at the top of the line, but going back to the cellular level. So if we look at something like spermidine, spermidine's working actually on sort of a very base process to actually help with depression and to help with autophagy. So it's actually working, and again, that's why it's in existence in semen, in breast milk, in foods that are healthy. It's because they're really helping to just keep autophagy at the perfect, not too much, not too little level. So my body can adapt to stress, get rid of damage, and hopefully prevent all these ongoing diseases. So it's actually working. I won't get technical about it, but it inhibits something called acetyltransferase. So it's one of the sort of molecules that is a negative regulator of autophagy. So it's actually working on this this almost genetic basis to actually help.
That's fantastic, yeah.
That's why you got to love something that's working the way our body meant it to work.
Yeah, that's so amazing. Yeah, you carry on. You're explaining this so well. I love it.
So one of the questions, I guess, is what is too much autophagy? What is too little autophagy, right? We don't really have the answer to that. And it's one of the sort of big questions in longevity medicine is, where is fasting too much? Where is the right amount of fasting? Where is spermidine dosing? You interestingly can't probably take too much spermidine. Your body will not, now have too much autophagy by taking too much spermidine. Because of where it's working, it's very self-regulatory. Mm-hmm. So probably there's not a dose that's too much. There's probably a dose that's a baseline maintenance nice dose that will just kind of keep us healthier. It's probably about 1.2 milligrams or 1.5 milligrams is probably a dose that's just a baseline. But what I do with Spermidine, a lot of my patients, like let's say I took one of your clients who has more a disease process already going on, like a depression, or in my case, my patients who already have arthritis. I may have to hit them a little hard initially. So you can actually use a higher dose of this product. I'll go up to like a 6 milligram dose, kind of a professional dose that you can do for like a 30-day period, right? And I always tell people it's like cleaning my house. If you and I are cleaning our houses all the time, right? You're accumulating trash. Every week you take out the trash, you clean your house, and overall the house stays nice. But if I went to a hoarder's house, could I just go in there and take out the trash and everything would be fine? No. So if we take people who already have some ongoing disease process, we probably have to do a big clean out. What I'll do is hit those people a little harder early on. And even in my own life, what I do with Spermidine is I'll quarterly do a big dose. So, again, it's like my closet. As good as I am at trying to keep it clean, it gets filled with clothes. Yeah. So, unless quarterly you clean out the closet, it's still going to be a mess. And so one of the things I really advocate is periodically doing a big clean house. So getting rid of all those damaged cells. So quarterly, you do a big clean house, and then you do a nice baseline, taking out the trash every week by doing a smaller dose weekly. So if you think of Spermidine as you're sort of, taking out the trash, if you have to take out a lot of trash, you got to use a bigger dose. I think it's a really simplistic way of understanding autophagy is sort of, we all understand the mentality of cleaning our house up, and the same thing's true in our bodies.
That makes a lot of sense. That's a great analogy for people to understand the concept. So again, how does that link to this depression, anxiety? So this is a study actually that's going to be completed in December of this year out of Bonn University that they were looking. So they went back to the autophagy, dysregulated autophagy, and this is from some old mice studies you're probably familiar with, where when mice are stressed, they actually have, they very much upregulate autophagy. And if you breed a mouse where it can't get this kill off of bad cells, they actually get very, very stressed, and they actually get into this very panic state, and they actually die. They can't do anything. They can't do the raises. They can't eat. They're dysfunctional. So it's kind of that end stage of depression, right, where people are just laying in bed and can't do anything. So basically, based on that premise, they thought, well, Spermidine should be a really good molecule. And indeed, it looks, and data should be published in December, I think, or shortly thereafter, it looks like this is going to be a very viable option as kind of a thing that we could use in helping treat depression and anxiety symptoms. That's a really natural, easy thing to do. Now, if you get it from food, can you get enough of it? The hard thing about our food sources is that a lot of our food is not really enriched in good nutrients anymore. So I think, and I know I've listened to a lot of your podcasts, you can't get by with just food alone. I think you need usually to supplement with some nutrients as well. I know you talk about B vitamins and things like that, and so you need to supplement with nutrients as well. I think this is a nutrient that in general most people need to supplement with. That's so interesting, because I know that in one of your podcasts that I listened to when you were interviewed, you mentioned that this is, I think you said the word, it's sometimes we get worried about a cure-all snake oil kind of concept.
Right.
People might, you remember saying so, I think it was with Dave, it might have been with Dave Asprey's interview. And I thought that was a great thing, because there are so many supplements and things out there. There are so many things that we need to take. So I know that people, and I'm saying this because I know that this is what my listeners are going to be thinking. Okay, so where does this fit in the regimen of what we should be taking? What is the priority list in terms of, what we should be doing and what we should be taking? Does that question make sense?
It does. And I think it's probably one of the hardest things, right? Because when you look at, wow, that's really good for me. That's really good for me. And I have this all the time. I have literally people who are working with a functional medicine doctor or, a chiropractor, somebody who is literally, the list of supplements they take is 3 pages long. I mean, I have no idea how they do it. It would make me completely anxious to do that. So maybe I need more Spermidine. I don't know, but we can't take everything that's good for us. So it comes down to, a few base things. Should Spermidine be in one of your base things? In my mind, so what I look for is supplements that are going back to the cell level, right? So the things that have the biggest bang for their buck are things that are working on the cell. So is Spermidine one of those things? Yeah, it's actually helping with autophagy, but it helps with making new mitochondria. Remember, mitochondria are the powerhouses of your cell that will give you energy. They make ATP. That's your money. So spermidine actually improves what we call mitochondrial biogenesis. It helps us make new mitochondria. It also is really protective to our immune system. So that's another place, right? When we look at the brain, we know that the immune system is a big player there.
Huge.
So inflammation causes our immune system to stir up again. If you can't normalize that reaction, then you go on to develop problems. We're seeing this, and you've probably seen a huge number of these people, right? The post-COVID people, the post-COVID brain fog and depression is huge. So why is COVID causing all these people to have long-term depression and brain fog? I'm seeing a slew of them, huge number. Well, number one of the things viruses do is shut off autophagy. They don't want cell death, right? That's not good for a virus. They want to grow. They want everything to keep expanding. So one of the first things viruses do, and COVID in particular is really good, it shuts off autophagy. So you measure autophagy markers when people are infected with COVID, shuts down autophagy.
Wow.
So now I've shut off autophagy. What is COVID also doing? Increasing all these inflammatory cytokines, these inflammatory proteins my body's trying to react to the COVID.
And protect.
So it's now stirred up this big immune dysfunctional response that my immune system can't recover from. So one of the other things spermidine is doing, besides helping that autophagy, is it's helping the T cells, those are your soldiers to fight against the infection, to function better. So it's going to help that immune system to recover as well, which is going to be a big part to the brain recovery, is getting the immune system healthy again.
I am so pleased that you brought that up, because one of the ways, and I'm sure you've seen these studies too, of people understand this viral response, in the way you explained what the COVID virus does in terms of stopping or basically suppressing I can't even say that word, autophagy, is also when we have if something toxic happens to us in our life, like a trauma or whatever level. I mean, COVID was filled with that builds into the brain. The brain's neuroplastic. So I always tell people that we understand that a virus gets in our brain, but do we recognize that a thought, which actually is built of memories and represents an experience, and if it's toxic, it's as physical as that, for example, COVID virus. So people don't put two and two together. And if you that's something I stress so much in my work, is that you have to look at your toxic experiences in the same way as something that's physically invaded. They're as physical as each other because it builds into your brain. So that response that you're getting to the COVID virus, you're going to get that to that toxic experience. And the more toxic it is, the more traumatic it is, the more the autophagy is suppressed. So the more the inflammation increases and the whole hyperimmune response. And so that's why we see with people that have gone through trauma, we see the brain fog. We see such similar types of manifestations or results, the effects of those that are very similar to biological, but they're two different sources. One is very physical, one is it's energetically physical, because an experience is also a physical thing, but it's on an energy level, versus the virus, which is more, it's more tangible. And so but the two create that same response. So I'm so glad you spoke about that. So
yeah, I think that's so incredibly interesting too, right? That simply a thought or an experience can have the same, you can measure biomarkers.
Yeah.
Like somebody's like interleukin-6 in somebody who's going through a very bad experience, and it will be elevated in the same way that somebody who just had an injury has it elevated.
Incredible.
So amazing that our body responds that way, right? That our immune systems are set, that emotional trauma is the same experience to our immune system. Our immune system still see there's something going on, and it sets off, this set of cascade of events that lead to, if not treated appropriately, which is why, if you look at all these people going through trauma, if we can actually treat these, traumatic events more acutely, I think a lot of those people get ignored, right? They have a traumatic event, and people are like, you're fine, brush it off, move on. And then, you see the result of them, I see the result of them.
Yeah.
Even in pain, back pain, for instance. You can go back and track back pain lots of times back. And that's, when you talk about John Sarno. Mm-hmm. And so funny, whenever I mention John Sarno's book, because nor would I would never say to anybody, this is all in your head. But when I recommend his book, lots of times that's the premise people think is, this is all in your head. And I'm like, no, that's not at all what I'm trying to say.
But it's even so.
Your brain is so powerful.
No, exactly. But even in your head, it was used as an insult, but it's actually so important.
Right. You're right.
people disregarded mind. Mind, without mind, you're dead. So mind is that energetic force that's keeping you alive. So, you and I couldn't have this conversation without our mind. Our mind is using our brain and our body. So it's logical that we actually should say, yes, it's starting in our head because we're processing these experiences through our mind into our brain and our body. So there should be this mind, brain, body, psychoneurobiological link, which is what you're talking about.
Right.
To be able to have a very baseline support system in terms of dealing with something on the cellular level and a substance that is so naturally occurring in our body and accelerating that in a very specific way, like you do in your practice, as an extra very vital tool in the toolbox. And if you think of a toolbox, if you had to ask someone who's got a toolbox, what are the most vital things that you need, that you have to have as a baseline or first aid kit? So Spermidine, from how I'm understanding it, is fulfilling a lot of that kind of function.
Yeah, I think that's the key. Is look in your supplement list. Look for those supplements that we know are working on the cell. So your B vitamins are going to fall into that category, right? I put in things like acetyl L-carnitine, lecithins. Those are all. I always think, okay, I need something for my cell membrane. So lecithins. Or newer, I don't know how familiar readers are with, or listeners are with plasmalogens. Plasmalogens are much newer, but they're a little lipid that coats our cells as well, that probably become depleted as we age or with traumas and diseases. Yeah. So I include a lot of thinking of the cell. Okay, I have to fix the cell membrane. So I'm going to do it with my lecithins, my plasmalogens. I have to fix the mitochondria. I'm going to do it with spermidine. Some other cofactors, coenzyme Q10 may be helpful there. There's other cofactors there. You need your vitamin Ds. You need your B vitamins. So when I think of the supplements I put people on, the micronutrients, well, number one, we do a lot of measuring micronutrients so we can tell what people need. But those basics that work on the cell are the things you want to focus to. If somebody says, "Oh, this is good for your liver," you might want to figure out, well, why is it good for my liver? And is it simply my liver that's going to help, or is it going to help a whole bunch of other things? Like N-acetylcysteine, super good for a lot of processes, right? It's a key ingredient for detoxification processes. So that's when I put into kind of a category of things that everybody needs. But again, it's going back to understanding these biochemical pathways. And I think that most doctors don't do that. They're working at a much higher level. So I'm going to say, could I just take Spermidine and that would be the only thing I ever took? No, you've got to have your B vitamins along with it. You've got to make sure you have enough vitamin D. You need your micronutrients. Make sure you have adequate of a lot of those things. But if I were to add on one supplement that was beyond those sort of basics, this would be there because it is working. We know on these processes that are going to, delay aging. The studies, now there's studies on it for, immune health. There's studies on it for hair growth. I mean, make sure hair grow. That's all people are losing hair during COVID. Well, that's all part of the same process. So actually can see improvement in hair growth with Spermidine. Like I said, encourage you guys to go out there and Google Spermidine and blah, because you'll find it almost, everything. It helps support healthy weight. So it actually gets rid of white adipose, the bad fat, helps bone density. If I do a stem cell procedure on my patients, I always put them on Spermidine afterwards because it enhances stem cell production. So, again, looking at one thing that you can do a whole lot with, this is a product that can do that.
I just want to emphasize something that you said, and please correct me if I'm saying it wrong. The concept that you're talking about here is not looking at a reductionistic approach to one, or it's almost like reducing down to like just the liver or just the heart. We don't function like that. It's like the mistake that's been made with the brain. It's right. It's that chemical. Nothing works in isolation in the human brain and body. Everything works in concert, and it's a huge symphony. That's where the biochemistry comes in, and that's where medicine should be working from the biochemistry up, not from the outside to the and stopping at the organ. And if you're lucky, the system. But it should be right down to the biochemistry. I cannot agree with you more. So I just wanted to sort of to emphasize that, and that's why I love the approach that you are using.
Yeah, and it's funny because we don't think that way, right? People sort of think, okay, you're working on the brain. That's that's the brain, and I just have to fix my brain. Well, like all those things you teach, from your app and all those things. Well, the key is, what are you actually doing that's changing the brain? Why are those thought processes changing the brain? It's because you're changing yourself. So is that now going to affect your fact that maybe your liver enzymes just got better? And it would be interesting to look, right? Can you actually simply do those types of things and improve that? We do know you can improve pain, right? Simply by thought processes. Exactly. Even if somebody's a very valid, I have people come in who have, every disc in their back is worn out, and you have them go through processes to change their behavioral thoughts, and their back pain improves. Why is that? Every disc is still worn out. What have I done? I've actually, it's not just, it's not just that I can think myself well in the sense, but I can actually change my cell. I can change the way my cell is functioning by the way I'm thinking,
Exactly. Mm-hmm.
So then you get, well, why don't I just do that? Well, probably because we get to a state where we don't have enough that even, I need to put all that together. I need the basics too. I need the micronutrients. I need spermidine to help my mitochondrial function better, to get rid of autophagy. And I need the thought processes, and I need all those things.
You need it all together, yeah.
You need it all together, right? Nothing works, independently.
Isolation.
The problem is that people don't work that way, right? And so I guess, like how often do I refer people for, like to all the things you've written when they have a knee injury?
No, it's not that connection. I love that you said that. That connection's not made that often. It's only when people I'm depressed or I've gone, then suddenly they bring in the mental health. But that knee injury, there is always going to be a mind component. So we stop talking about mental illness and we start talking about mental health and mind management. We shift the perspective, and that's what I would do with a lot of physicians. Is talk in the way we're talking now. Is let's shift our perspective from, instead of looking at the individual as only when they're mentally ill per se, and they're coming with extreme states, when they have a sore knee, what else is going on?
Right. What else is going on? And that's what I try and teach people too. I go, there's a lot of people who have horrible looking knees and they have no pain. It's an inflammatory process. That same inflammatory process is causing dysfunction in your brain. It's why when you take them with a chronic disease, they are almost always depressed. And people are like, well, of course they're depressed. They have a chronic disease. Mm-hmm. It might not be that. It might be simply that there's this inflammatory reaction that the brain is responding to, and I need to change that inflammatory reaction by my thought process, by my supplementation, things like that, right?
And also finding the cause behind that, because it could be that the whole reason that people, the cause is not necessarily in the brain. If it is, if it's depression, it's the cause is in the life experience.
The system, right.
You have to look at the environment. And I don't know if you find this, Dr. Yurth, but people, like, you tell someone about something like Spermadine or the approach that you're using, which is phenomenal, by the way. I mean, just love what you're talking about with everything, the whole holistic approach that you're using right from a cellular level. But people then are quite good at taking stuff, because I can take the external and put it in.
Yeah.
Quite the same and I've got to do the mind stuff. You've got to do that work as well. And you've got to have the two together, because if you're sorting out the body, you're sorting out this from the cellular level up. If you don't manage the mind is breaking down as quickly as what you're building up. So now you've got a conflicting process happening. You're going to have a dissonance happening unless you work with mind and body at the same time.
Right. It has to be together. One of the questions I asked some of my people who have really just chronic pain and chronic bad diseases is, can you actually picture yourself being healthy? And if that answer is no, that's a big problem, right? If I can throw spermidine into the mix, I can throw every supplement into the mix that should make them better. If their answer is still no, I can't see myself healthy, probably I'm not going to make headway. It's why, people are like, well, that didn't work for me. There's a piece, the two pieces have to be put together. I can't fix everything with my supplements. You can't fix everything with just the brain piece too, or with the mind thought processing. They have to kind of go together. But that's not melding much in anybody's fields, right? How often do you and I work together? If I have somebody who has horrible pain in their knees, or neuropathic pain after COVID or things like that, so often, and you and I welcome your education to be on this. It's sometimes very hard to get people to understand. I'm not saying at all that this is something, that you don't have pathology, but I'm saying that you've got to work with fixing how you're thinking about it, how you're approaching this if you're going to get well, right?
Yeah, totally, absolutely. Because your expectation, it's basically a mindset. So it's a perception, it's a mindset, it's an attitude. That is energetic force. Like, the easiest way to understand, the way I would talk around this concept, is if you think of the fact that you and I are not floating, we're both sitting, and that's because of gravity. We can't see gravity, but we know it exists because we're not floating. Same thing with mind. You can't see mind, but we know it exists because you're now able to have a conversation and people are listening to us. If we were dead, we wouldn't be able to do this. So you see mind in that way. Therefore your mind is driving the functionality of your brain and your body. So if you are constantly saying, I can't do this, that mind, that gravitational biofield is very real. It's sending that energetic quantum energy by changing your biochemistry. It's changing your totally right down to the biochemistry of your
cell. Right down to the cell level, right
down to the cell level. There's the wiring in the brain, right down to every 37 to 100 trillion cells, however many it is. It's a lot. All of that is changing. And so a negative expectation is set up that is biologically programmed by the mind, and then it's going to downgrade the functionality. So therefore you could put all the spermidine in that you want, and there will be a level of upregulation of autophagy and whatever else is it's going to do, but it's going to get whacked down again. It's like it's those toys that bounce up, whack it down. You bounce
I sort of similar to I think about this like a viral infection. Well, there's if the virus is still there, if I haven't gotten rid of the virus, then I can keep throwing that agents in to make the person better, but they're still fighting the virus. Exactly. If the brain is still sending these messages that I'm in an inflamed state,
exactly,
all I'm doing is I'm the front line of the fire, trying to keep it from burning farther, but it's never getting to the root of the fire. I'm not putting the fire out, right? Exactly. So that's where you have to sort of you have to look at that piece as that's the final piece if I want to get to the back line of the fire, because what I'm doing with every supplement I can throw into the book may just be keeping the fire from approaching my house, but it's so I don't kill myself, but it's not treating the underlying problem, which is still that my brain is keeping my body in this inflammatory state. So I think that you have to do works, so in concert with each other.
They have to do, and we have to choose from the overwhelm of all the different things that we can do. We have to choose from the best type of thing, and this is why I do interviews with people like yourself, because I'm trying to find the best things.
Right. What are the
mental health toolkit?
Yeah. And I do think that for me, it's the simplest way of looking at things. When I read about a supplement, when I read about all these things, I go back to okay, one, how would the cell do this if it was a young, healthy, perfect little baby cell, right? I've just been born. Nobody's traumatized me yet. Well, maybe not. Probably you still got all that epigenetic trauma.
Yeah.
Let's say the perfect,
in an ideal world, I
have this perfect little cell. So what can I do to try and get my cell back to perfection? That's why I look at things that are working that way. That's so when you throw an antidepressant in the book, is it actually fixing the cell the way the cell would fix itself? No. Is spermidine fixing itself in terms of the autophagy process, in terms of of how the cell would fix itself? Yeah, that's what my body does to try and heal these events. So it tries to respond by increasing autophagy. So I can do that. I mean, fasting does work. Fasting does help. The problem is, fasting's hard. It can be kind of traumatic for some people. Take someone with, for instance, an eating disorder, right? And now I tell them to fast. Horrible thing to tell them to do, right?
Terrible. Terrible.
But is spermidine a nice option there? Like I would take somebody with an eating disorder or a history of an eating disorder and tell them to start fasting, right? As an autophagy tool. But here's a nice autophagy tool that I can offer them. That again, it's a food. It's a food. So it's pretty hard to go wrong with the food. I do get it is made from a wheat germ extract, but interestingly, it actually is pretty safe for celiacs. I've lots of celiac patients on this. Number one, it's a very, very small amount of wheat germ. Number two, spermidine itself actually has been explored as a treatment for people with celiac because it actually lowers one of the abnormal processes that's going on in the gluten becoming inflammatory to these people. So it is a non-inflammatory way of sort of still getting a small amount of gluten, except it's in a non-inflammatory approach. So it's actually spermidine and putrescine, some of its cousins have all been looked at for that. I will caution, when you look at spermidine, there's more and more spermidine coming to the market. One of the things, much like CBDs, and is that you kind of want a full spectrum instead of isolating down little pieces. So one of the cool things about Spermidine Life, which comes from Longevity Labs, that I like, is it is actually a full spectrum. So it actually doesn't just contain spermidine, it contains other polyamines together, because that's where our body really wants it. It wants it with this full spectrum. So it's a much safer, better, as opposed to isolating things out. Because, and again, when you have a lot of people doing hemps and things like that, full spectrum hemp may be better for some people than isolating out little pieces. So that's one of the interesting, compounds. It's actually a combination of 4 different polyamines. So it has like spermidine and putrescine and cadaverine and spermine, all those together. So we sort of hang our hat on spermidine, but you really want that full spectrum because that's how your body actually, if you just throw one thing into a mix, lots of times it'll start overloading that piece. So I want to pull the full spectrum in because that's the way our body would get it from a food source.
Love that. That's so important. So you've said so many important things, but I just want to stress with my listeners and viewers there that you want to always go with in a holistic sense. So you don't want to just have, because I know in some of your podcasts and things, you comment there, just be careful of like getting it on Amazon. You want to have the full spectrum. So find out about so that's the one thing, you've got to have the 4 different polyamines in the spectrum, and that's what Spermadine Life is offering. And then you said something else that was really interesting as well, is that our body wants what's natural for us, and then it can work with that. So if you put too many external things that our body has to still learn how to deal with, you don't get quite the same benefit. So something like antidepressants, not fixing a disease, it's just psychoactive. It's just changing a brain state and suppressing emotions, but it's actually changing the brain in the long term in a negative sense, whereas Spermidine is in the body.
Right. It's fixing the cell the way your body wants to fix it. And that's what you really have to look for. In every supplement you look at, go back to what is that doing to my cell. There's a lot of supplements that are doing nothing at a cellular level. Not to say they're not useful, but they're probably not, they're not going to be as beneficial. And then there's a lot of things that actually can't even get into the cell that people take, and yet people are like, oh, this is really great for the cell. And you look at the molecule, it can't even actually get to the cell.
To the membrane,
So I think those are important things to keep in mind is, you want to look for things that and this is hard because unless you understand the cell, you understand biochemistry, and it's where, working with a professional, and there's not a lot of doctors who are specialized in cellular medicine. We're actually, I'm on faculty for something called Seed Scientific Research and Performance, and we're trying to actually get fellowship trained physicians in cellular medicine. But it's such a hard thing to learn. And doctors, I don't know if you're experienced, but doctors kind of want, in general, oh, here's my disease, here's my pill, boom. And to go back and say, we need you actually to learn 6 different pathways of the cell, and then we're going to look at what can we do to change these pathways. A lot of doctors lose interest pretty quickly. So you find the right providers who are actually willing to actually understand and learn and watch for new things that are available.
I'm so glad you brought that up because it's the same sort of thing in mental health. If you think of the rotation, you've done medicine, the rotation is 1 or 2 or 3 weeks, maybe 4 weeks maximum. And the rotation is around, this is the disease and this is the drug. And that's not even what mental health is. That's not even scientific. It was 56 years ago, it was already shown that that's not the right approach. But that's what doctors are getting. So if we could come in the ideal world, have you coming in and teaching, you and your teams getting cellular medicine trained in their first year or second year as a med student, and mental health as well, bring the two together, train this cellular approach with a correct mental health approach, we would have such different outcomes with people.
Well, and if the first person, when somebody is, has a traumatic experience, if you could convince people that they need to be seeing you right away, or, one of your people who've trained under you, okay, it's what I tout with an injury. If you hurt your knee, your first inclination is to go to your orthopedic surgeon. Your orthopedic surgeon sticks steroids in it, and that worsens the problem. Just like that person that young girl came into her psychiatrist and he goes, well, let's put her on a little Prozac, that'll help her, right? Instead of dealing with what took that 13-year-old girl right then into the state of depression, which was some traumatic event, right, or something.
Deal with that
unless you treat it acutely, it's going to go on and create pathology.
Exactly.
But you don't get to see them acutely. I don't get to see that knee patient with the torn cartilage goes to the orthopedic surgeon and ends up with a knee replacement. If I could intervene early, if you could intervene early, we avoid these diseases. So I would say even like if you have somebody, and again, this is in the mouse studies pans out. If you take spermidine, these mice who are under stressful situations, they actually have better outcome. Same thing's true when I have a joint injury patient. I put them on spermidine acutely because it's going to block this inflammatory process so that I don't go on and have abnormal autophagy, hence my cartilage cells dying and neurons dying. So, I think that one of the things we need to teach people too is that acute events need to be addressed, not just, wait until 4 years later when there's a lot. Now you got to deal with the hoarder house, right? Oh. We'd rather deal with it when there's just a little trash and not the hoarder house, but how do we get that message out there that, the first thing is not run to your psychiatrist and get your antidepressant, but actually start dealing with somebody who will teach you, how do I change my brain right now before those patterns get set in.
Yeah, change
my mind, right.
I love that so much. I studied at UCT at the time of Dr. Chris Barnard around that time, and we were trained in this holistic approach. We worked with the med students. It was always a team. So if someone came in with some acute issue, automatically all of us on the team, there were like 10 of us on the team that would then look at this holistically. But that's expensive and that takes time. And that's, whereas now it's just, pop a pill and.
Right. And I argue that's getting worse, right? Because now you have to see people faster. You have to, move people through more quickly. So there is no space. It's much easier to say, well, here's a pill, get out of my office. And now 10 years later, what are you dealing with?
Yeah, exactly. Down the line, it's the medication. The expenses are way worse. So the implications in relationships, work. I mean, we know, you and I both know what we talk, and people that listen to this podcast, they know this as well. That's why people are desperate for change. So that's why you and I do what we're doing, which is talking about these things and from a grassroots level, educating the individual to take more charge of their health, which is more and more, and ask the questions. Don't be scared to challenge and say, hey, what about this? What about that? And it's really good that we can help people to do that.
Yeah. So, kudos to you for getting that message out there and keep spreading it. And I think people need to start looking at every one of these diseases as the same process is going on, that we get this dysfunction at a cell level, and we need to intervene at a cell level, because that's going to help everything from going. That'll help, whatever this traumatic event that this person experienced that started out now with some mind dysfunction that now has led to, now I have chronic horrible back pain, and they come and see me with their chronic horrible back pain, and I'm trying to now unwind all the way back to the basics.
Back, and it's just such a difficult thing to do, and their volcanoes now exploded in their life. Right. It's not easy, and this is not good medicine. This is not good mental health. It's not helping, and we can see it. We can see with the studies where people are dying younger, they're getting sicker, the deaths of despair. The evidence is there that the way we're practicing is not working. So we have to address this. So thank you to you for what you are doing. And just as we're talking, I'm thinking you and I need to do some research. We need to put the mind stuff together. We need to put all these different elements, the cellular, this holistic model, and do some hands-on research and.
I was thinking that as you were talking too, because we're actually doing a lot with a company that's doing what's called proteomics, measuring proteins. Can we look at that connection, like after patients have, for instance, people have done your program before and after? Can you actually look at proteomic signature changes that have occurred to really show people, listen, that same protein that was very high level, that was a bad protein, and then you do this program where all you did was change your mindset. Exactly. And now that protein is reduced, and that's now affecting every other piece of your health, right?
Exactly, which would be incredible to show me.
To show that realistic data that here's actually a protein. Nobody can fake that. This is a protein. Well, now we have the capacity to do that.
Exactly. That's what we showed with this research is changes in telomeres, percentile length in 9 weeks. I mean, it was amazing, and showing the basics, homocysteine and cortisol and DHA ratio, but also looking at QEGs, we saw significant links between the changes in the neurophysiology and mind management and the person's narrative back in life. So it's not just about symptom reduction, it's about how you're coping back in your work, relationships,
everything that makes you
exactly so
a functional human being and a happy human being.
Exactly. We were seeing lots of people getting anxiety and depression under control of up to 81% and massive changes in 9 weeks period. So I think you and I need to have an off-air conversation and do some research. And I just want to thank you for your time and your wisdom and your work, and for opening a whole new world to people of medicine, a different way of looking at preventative healthcare. That is just so, and then when people are in an acute stage, you can address it from that end too, but how we can also be educated to understand there's some basic processes, cellular processes that we can do something about in a very holistic way. So thank you so much for all the things that you're doing. It's quite amazing.
Great. Yeah. And I think that Spermidine Life is offering a special, I think, for your listeners.
Yes, there
is. So
the whole special, which I'm going to put in, there's a very general 25% discount on your first order using
that's huge.
Leaf 25. It's huge. So we'll be putting that in the show notes. The introduction.
Yeah, you guys. Honestly, I mean, and any of you who are dealing with some chronic illnesses or things, I kind of encourage you to you can do a higher dose, do this kind of pro version for at least a month, just to kind of again clean out house. It'll get you a long way. I think sometimes the hard thing about some of these supplements that are working on a cellular level, it's not like you instantly feel better. It's not like, oh, wow, I just, like somebody took a painkiller and their pain's gone, but it didn't actually treat the problem. When you're trying to fix things at a cellular level, be patient, be understanding that it's not going to be this all of a sudden I'm better. But we know we follow markers on people. We know this stuff works. We see everything from improvements in lipid functions to improvements in inflammatory markers. So we know that they're working. Even sometimes it takes a while for you guys to catch up and sort of feel it doing anything. I think it's one of the hard things, right? Sometimes people, I'm sure you too, you've got to encourage people. Sometimes you don't instantly feel better. You just got to stick with this plan because we know it's the right plan.
Exactly. Well, that's exactly what some of the research I've done is looking at these time plans, because I saw it with my patients, and it's 9-week cycles minimum. You're not going to get anything. People always think, 3 weeks is the magic number.
Right. Yeah, I'll be better. Yeah, I would tell people 12 weeks. I would tell people, 3 months.
Yeah, 9 to 12 weeks, and then you can start seeing something, and then there's multiple cycles. So,
and then it increases from there, right?
Exactly.
But, yeah, people really do. We're sort of an instant gratification society, and if somebody's like, if I'm not better after a week, I'm like, well, that didn't work.
I know people will say to me, like, because I say, listen, it's minimum cycles of 63, 66 days to start really having some kind of changes in your behaviors and so on, because you've got to rewire mind-brain-body connection and change things at the cellular level. This is hard work. And people say, don't you have 5 quick tips to just get No,
give me the quick version.
Exactly, and you're going to probably get worse before you get better, which is
right. Exactly. You're exposing a lot of things that, and that that happens sometimes when you have these autophagy processes. Even is that there's a little bit of cell die-off that sometimes people feel like they feel a little worse before they start getting.
I wanted to ask you about that, so that is something, and I wanted to so I'm so glad we brought that up as well. Well, thank you so much, Dr. Yurth. I think we just started one of many discussions, and it's been absolutely fascinating, and I've loved talking to you. So thank you so much.
Thank you, Dr. Leaf. Keep up the good work.